Now it's time to listen to Sister Jiji Mathew, a Holy Cross of Trichy sister, who will be speaking to us on spirituality of care in the nursing profession. A trained nurse, a student-friendly teacher, and an efficient administrator. At present, Sister Jiji is the provincial counselor and administrator of St. Louis Hospital in Manu. Over to you, Sister Jiji.
Good evening, everyone. I begin with a special note of thanks to Reverend Father Saju Chakalakal, CMI, for the choice of me to be one of the panelists. And I acknowledge with due respect the presence of Reverend Fathers and Sisters, and a special thanks to Father Julius for your kind words. The topic given to me is spirituality of care in nursing profession. And I would ground my views on spirituality of care in good olden days and the gradual changes by and large, but not deliberate, with the introduction of high-tech science-based care. And then move on to the attitude and the disposition a professional nurse needs to take her role in order to tackle or the human spirits, providing evidence-based or science-based care. For many patients, life serves as a catalyst. The meaning and purpose of life, queries such as why, what, and why now. Healing is more than a technical cure, or in fact, it's a journey to integrate these questions like why me and why now into one's life. Optimally, spirituality is a foundation for patients to move from a sense of brokenness to the end of life, which was in the presence of dear ones at home, supported by prayers and other rituals. Early times often happens in the hospital in the present times. It is nurses who accompany them in their journey during these crucial and delicate moments. In this way, spirituality is integral to and helps to address understanding of illness, further helps to find value. Let's look into the and nursing. According to the Ministry of Health Care or Health Promotion, provided to persons both sick and well who require care, support, or education to assist them in achieving, regaining, and maintaining a state of wholeness, including wellness of body, mind, and spirit. This definition asserts the significance of care of mind and spirit, and mostly all the definitions of nursing are holistic in description. And according to brothers McCarthy and Coffey in 250, spirituality refers to an individual's feeling of connectedness to self, other persons, and to the cosmos. It's an individual's perception regarding the purpose of life and the ability to modify the personal perspective of life, including suffering. Hence, spirituality is something incredibly personal. It's something how one relate to God. He's connected to oneself, others, and the cosmos. So as in this iceberg, spirituality is based on an individual's values, attitudes, and beliefs related to God, others, and nature. And we have the most touching example for now and all times to come from Jesus' famous parable of Good Samaritan. This parable actually unveils what is meant by spirituality and the spirituality of values and attitudes that should be possessed by a nurse or any healthcare professional. A man who was traveling to Jerusalem from Jericho was attacked by robbers. They robbed him, beaten him up, left him, and half dead. A priest came on his way, saw him, and did not bothered to see what has happened to him, and he went on his way. Same was done by the Levite, or someone who assists the priest. Next came an ordinary man. When the man was left on the road, his heart was moved. He saw him. He had compassion for him. He went close to him, touched him. He dressed his wounds, gave something to drink, carried him on his donkey, reached him to an inn or a small hospital, paid the innkeeper, asked them to take him, and said that he will come back after his business. Now there are three persons. The response to this situation, to the man who was helpless, who was left alone, was based on their spirituality, means their attitude towards the sick person. They connected it to self and God, the philosophy of their life, or the basic beliefs on which they think what is good and what is right. Now, what's the spirituality of care inherent in nursing profession? What is intrinsic or very fundamental to nursing profession? We'll just glance back to the history. Egypt, Greece, and Rome and Israel, they were considered as the ancient important society. In all the literature available, it's very clear that spirit, they considered that it was an important aid to therapeutic procedures in medicine and nursing. They believed in the healing power of God and infused that into the lives of their patients. The next era was the period of deacons and deaconesses. Care of the sick was an identified task of these men and women who followed the spirituality of Jesus, the great healer. They went around to visit and nurse the sick, and certainly they gave importance to the spiritual health of the patient. Then came the monastic nurses, and they placed the care of the sick above and before every other duty, as if in it Christ were being directly served. And rule of Saint Benedict, 529 AD, which writes that they saw the face of Christ in every sick person and cared for them. So from the history, it's very clear that the spiritual aspect of patients or those who were ill were taken care of in the ancient past. Then comes the reformation in nursing by Florence Nightingale. For Florence, nursing was a vocation. She chose to be a nurse with a great desire to provide comfort and care to the wounded, and she had given special attention to holistic health. Her writings revealed that she clearly understood the connections between spiritual health and healing. She always considered that spirituality or caring for the spirit was an inevitable part of nursing. In the early mid-20th century, nursing was attached to the convents and the churches, and certainly the young nurses were taught how to foster or develop their own spirituality, or how to be spiritually healthy person and to take care of the spiritual health of the patient. Even after the beginning of postgraduate and doctoral programs in 70s and 80s, adequate attention was given to the holistic and spiritual aspect of care. And further, nursing as a profession has developed significantly during the past half century, given the great scope of it. The vocation or spiritual calling to care for the sick is slowly getting vanished. There's a heightened concern or focus on professionalism. And added to it, many nursing colleges are opened with too many intakes, often not attached to a hospital. And on the other hand, with the scientific advances in the society, human spiritual nature has become more complex, especially regarding health and disease. These changes are always recognized by the society, and many researches are undertaken in the recent past to study the competencies in spiritual care. The result proved that the present-day nurses have low acquaintance with the spirituality concept and how to provide spiritual care. And they found the following reasons for it: lack of educational preparation about how to incorporate spiritual care into practice, confusion about what is spirituality really is, a lack of competence in incorporating spiritual aspects of care, a lack of time to address spiritual needs with too much documentation. And they've brought forward certain strategies to enhance the spiritual care in nursing, and it could be activated in 3 levels. The first and foremost, we have the individual level. The dispositions that are mandatory to touch the human spirit or to care for the human soul is a sort of self-awareness, which means the knowledge of one's own spiritual worldview. Spiritual sensitivity, again, that enables the nurses to identify the patient's spiritual needs accurately, and a caring presence disposition, which will further enhance a trusting relationship between the nurse and the patient. For this, one needs to have a deep reflection of one's own personal beliefs and spiritual views, and consider how they influence the nursing care, and practice daily reflection activities that are personally useful or resonate with the person, like meditation, mindfulness, prayer, etc. Then create and participate in spiritual groups with colleagues and friends, which may promote one's own spiritual growth, and look for continuing education programs on spiritual nursing practice, and advocate a culture of spiritual care in the organization. And coming to the professional or education level, it's mandatory to integrate holistic nursing core concepts into nursing curriculum, with an emphasis on spirituality of nursing care, and some universities have already done it. Then there should be inclusion of spiritual assessment in patient assessment, both in undergraduate and postgraduate nursing levels, and use of self-assessment tools that will encourage the students to explore their own spirituality. And there can be discussion activities in the classes about the spiritual beliefs to assist the students to connect to their own self and distinguish between spirituality and religion, because these both are two entities and it would be mistaken for the other. And use of simulation techniques in the classes in order to address spiritual assessment and a variety of health conditions, so that the students will acquire proficiency and their comfort levels will be increased. So this will enable the nurses to confidently assess and provide spiritual care to the patients. Coming to the organizational level, first and foremost, we need to furnish our mission statement with the essential components of spiritual care, and develop organization strategies like offering ongoing spiritual education programs for all employees, considering the impact of spiritual care and making administrative decisions when it comes to nurses' workloads, and make it mandatory to include spiritual care in the patient health record, and have explicit nursing policies like incorporating the spiritual assessment at the time of admission itself, and developing spiritual plans of care. Again, what are the dimensions of reaching out in spiritual caring? What is most important? The first and foremost, being with the patient in their experience of pain, suffering, and other problems. It's a sort of caring presence. Be truly present with the person who is suffering, with compassion and empathy. Next, we have listening to the patients and encouraging them. Let them verbally express their emotions, which may be hindering the achievements of their wellness and bringing healing to their heart and soul. Along with some search for meaning and purpose, use some spiritual language and provide honest answers to spiritually related questions. Next, we have touching the patients physically to assure them of their connectedness with others and with God, and to do it with an affirming eye contact. And these behaviors of being with, listening to, or touching the patient should be grounded in nurses' spiritual philosophy of life, as seen in the parable of Good Samaritan. Now, what are the activities that would assist in providing nursing care? First and foremost, we have counseling. People have hurt so much. They suffer a lot. And the main thing is to listen to them and let them express their pain. And the counseling a person's spiritual distress can constitute growth experience for the nurse while providing support for the patient. Next, a word of prayer, silent or vocal, mean a lot to a suffering patient. Promote connection with the possibilities of realities that is beyond self. And use of sacred scripture. Nurses may encourage them to read it and ask someone to read for the patients. And use of religious articles, religious rituals. The concept of rite of ritual has potential for healing, like anointing of the sick in Catholic tradition, and nurses can encourage that. And devotional articles, according to the different religions, nations, nurses can encourage them to pray with, and use of sacred music. Music, especially sacred music, expresses the in-depth feeling of one's spirit, and it can bring healing to the soul, healing to the heart. Now we shall have a report from some qualitative studies, only one or two. Sarah, a BSc nurse with 12 years of experience in hospice care in pediatric oncology, she says, I've chosen nursing for its ministry aspect. I feel really a sense of mission in nursing. It is a spiritual ministry. Every morning I try to spend some time in prayer and read the Bible verses to give myself strength. I know that I can heal the children, but just be there. That helps. And I pray to God, and it will work through me to use my hands in some way to comfort or to do the right thing for the patients. And Martha, a critical care nurse who is working with an HIV/AIDS patient, she says, I found that ministering to people with HIV a very humbling experience for me. And have also been some of my most rewarding experiences in this ministry. All they want is a touch, or just to know that you are there. They don't want anything else. And spiritual needs of a dying person. Despite the uniqueness of the individual, some universal needs are identified for most dying persons. These include the need for relief from loneliness and isolation, the need to express anger, the need for comfort in anxiety and fear, and the need to alleviate depression and find meaning in the experience of death. So, hence, a nurse with a greater understanding and acceptance enter into the brokenness of a patient and lift their spirits up. In turn, it becomes beneficial for both the patient and the nurse. And we have Lini, one who lost with the Nipah virus. It is said Lini showed love towards everyone. She was always like that. She used to treat every patient under her care as her own family member. So coming to the conclusion, as nurses fly about, their feet barely touching the ground, often they forget in the busyness that they're standing in the holy place while caring for the patients, that they're caring for God Himself in their patients. And they need to take off their shoes and get into the shoes of their patients and care for their spirit in the innermost part of their being. So take off your shoes, for you're standing in a holy ground. That should be the spiritual posture of every nurse. And the spirituality of care in nursing profession. It is a great conviction by every nurse that I am caring for God Himself in my patients. Thank you.